Madam Secretary, good morning. Would you please introduce our agenda for today?
Thank you, Mr. Chairman. Good morning to you. Good morning, Commissioners. Today's agenda includes 3 items for your consideration and a presentation. First, you will consider a notice of proposed rulemaking initiating reforms to the Universal Service Rural Health Care Fund to expand the reach and use of broadband connectivity by healthcare providers throughout the nation. Second, you will consider a notice of proposed rulemaking and notice of inquiry to increase value, utilization, and investment in the 2 gigahertz Big LEO and L bands of the mobile satellite service. Third, you will hear a presentation providing an update on the progress towards a spectrum inventory. For your fourth and final item, you will consider a notice of proposed rulemaking seeking comment on streamlining the tariff filing and formatting process by transitioning from paper to electronic filing to reduce industry burden and promote an open, transparent, and efficient flow of information. This is your agenda for today. The first item will be presented by the Wireline Competition Bureau. Sharon Gillette, Chief of the Wireline Competition Bureau, will give the introduction.
Thank you. And team, please proceed. Take your time, and then proceed.
Good morning, Mr. Chairman and Commissioners. Today, the Wireline Competition Bureau is pleased to present a notice of proposed rulemaking initiating reforms to the Universal Service Rural Health Care Fund. I would like to thank the staff from the Telecommunications Access Policy Division for their work on this item. In addition to those with me at the table, the following division staff contributed to this proceeding: Jamie Suskind, Erica Myers, Claude Aiken, Dan Ball, Ramonda Williams, and Cindy Spears, as well as Lisa Gelb from our front office. Seated with me are Carol Maddie, Deputy Bureau Chief, Tom Buckley, Senior Division Chief, and Senior Deputy Division Chief, and Ernesto Beckford, Attorney Advisor, who will present the item on behalf of the Bureau. Thank you.
Good morning, Mr. Chairman and Commissioners. This notice of proposed rulemaking proposes to reform the rural health care program to improve access to broadband connectivity for more than 12,000 public and nonprofit healthcare providers across the nation. Greater broadband connectivity has the potential to revolutionize healthcare delivery in rural areas by enabling doctors to access state-of-the-art health IT solutions to deliver world-class care to their patients, no matter where they are. Broadband-enabled health IT not only improves healthcare and saves lives, but will substantially reduce costs by shortening average hospital stays, reducing the need for duplicative medical tests, and increasing administrative efficiencies. This revamped program would invest up to $400 million annually without imposing new costs on consumers. In addition, by requiring matching funds, the program forges public-private partnerships to make fiscally prudent investments. Specifically, the reforms we propose today include the following. First, the notice proposes First, the notice proposes to create a new health infrastructure program which would support up to 85% of the construction cost for new or upgraded broadband networks connecting public and nonprofit healthcare providers in rural areas to medical institutions where more specialized care is available. In doing so, we build upon the lessons learned from the Rural Healthcare Pilot Program. The notice proposes funding network deployment on an annual basis in areas where either broadband is unavailable or the existing infrastructure is insufficient to support the type of health IT applications that healthcare providers need. The new infrastructure program would focus on closing the connectivity gap that exists in rural America by funding networks that connect, for example, rural clinics to urban hospitals, data centers to healthcare providers, and skilled nursing facilities to physicians and specialists. Second, the notice proposes to replace the existing underutilized Internet Access Program with a more useful Health Broadband Services Program. Since the Internet Access Program was created in 2003, healthcare delivery has changed. For example, due to privacy laws and electronic healthcare record requirements, secure transmission of health IT data needs to occur over a dedicated connection used exclusively by healthcare facilities. Our current program limits funding to transmission over the public internet, which may therefore be of little benefit to healthcare providers seeking to utilize health IT to improve healthcare delivery. The revamped program also would increase the share of the monthly recurring cost for broadband services provided to public or nonprofit rural healthcare providers from 25% to 50%. The new broadband services program would benefit rural healthcare providers that have not to date significantly participated in the existing Internet Access Program. It would also benefit current participants in the Rural Healthcare Pilot Program once they deploy new networks to serve unserved communities by sharing the ongoing cost of service to these communities. Third, the notice proposes to update who is eligible for funding to reflect the changes in healthcare delivery. As our nation's population ages and the cost of medical care continues to rise, the healthcare industry is looking for ways to provide necessary care in a less costly setting. The notice proposes to expand eligible healthcare providers to include acute care facilities that provide services traditionally provided at hospitals, such as skilled nursing facilities and renal dialysis centers. The notice also proposes to allow participation by data centers and administrative offices that do not share the same building as the clinical facilities of a healthcare provider, but that perform support functions critical for the delivery of healthcare. This could expand access to broadband connectivity from roughly 9,800 eligible healthcare providers today to 12,000 healthcare providers across the country. Finally, the item seeks comment on ways to enhance ongoing evaluation of the rural healthcare program and implementation of performance measures. This would help ensure that the public realizes benefits from the investment of universal service funding to improve broadband connectivity for healthcare providers. The Bureau recommends adoption of this item and requests editorial privileges. Thank you.
Thank you very much. Excellent presentation. We'll now hear comments from the bench. Commissioner Copps.
Well, thank you very much for that item. Bear with me if my voice sounds a little bit strange. I'm battling a bit of a summer cold. But this is another really important step forward toward achieving the goals of the National Broadband Plan. It's also a steep challenge. We all know how rural America lags behind the rest of the country when it comes to accessing first-rate health care. It's really not an acceptable situation for a country so prosperous as our own, and that's why I have been so active over the years I've been here, encouraging the Commission to be more proactive in putting the Universal Service Fund's rural health care dollars to better work and to better effect. I have seen firsthand, both in the lower 48 states as well as in Alaska and Hawaii, the huge impact that telemedicine and telehealth can make in improving quality of life in our rural communities. In areas that have the funding and know how to access and use it, telecommunications infrastructure gives access to desperately needed services like patient diagnostic services, patient follow-up care, educational offerings for rural health care professionals, and the dissemination of all sorts of critical health-related information, to name just a few. When it comes to the well-being of our citizens who live hundreds of miles from the nearest hospital, or even doctors, and are in need of medical care, telemedicine can be not only life-altering, but even life-saving. And we're only at the beginning of what this transformative broadband technology can do to improve the health and well-being of each and every citizen in rural America. We've known for a long time now that the existing rural health care program has not been living up to anything close to its potential. With a set-aside of $400 million a year, we disperse less than 20% of that amount, and in some years far, far less annually. In 2007, the Commission established a Rural Health Care Pilot Program, which has been an eye-opening experience, I think, for all of us at the Commission, showing us firsthand the need for a health infrastructure support program and demonstrating what we need to do to make such a program work. To date, the pilot program has made funding commitments of up to $216 million for 29 projects that will link hundreds of hospitals and facilities regionally in 24 states. An additional 36 projects are moving through the process and making progress. That's a good start, but we have many miles yet to go to meet the infrastructure needs of healthcare facilities in our rural areas. In the NPRM, we see comment on creating a permanent fund for the build-out of much-needed health infrastructure in rural areas. It poses many questions in an effort to cover all the bases, from expanding the list of eligible recipients, to awarding support to applicants with the most efficient proposals, to providing safeguards against waste, fraud, and abuse, and everything in between. In addition, we see comment on reform of the existing health care fund to provide support where needed for access to telecommunications and broadband services. We must keep in mind that the basic task is to get a high-speed, high-capacity broadband network to these institutions, and we must make sure this process is accessible to eligible applicants. As we have learned from our current rural health care program and from the pilot program, any such program needs really good outreach and really good user-friendly application processes. The rural health care program is as strong as the community that knows about it. And while any funding program must seek to deter waste, fraud, and abuse, the complexity of the process must not be allowed to deter worthy applicants. This is no easy task, and I appreciate the details in today's inquiry. I have high hopes that the notice brings forth really a fully developed record from a broad spectrum of interests, and I'm pleased the item specifically encourages input from tribal governments. I thank my colleagues for their support of the Rural Health Care Program, and I want to express my gratitude to the Bureau for its hard work on the item. I truly do believe that our Rural Health Care Initiative can be the signature item of this Commission, and one that can be as life-changing and transformative as just about anything we do around here. So I'm delighted that we have this item before us today, and I hope we can develop the record and get on to action and make the changes that need to be made to give rural Americans the kind of health care they deserve. Thank you.
Commissioner Cobbs, thank you. Commissioner McDowell.
Thank you, Mr. Chairman. In establishing the Rural Health Care Program, Congress recognized the importance of rural America having access to advanced health care just like urban America, and it envisioned that this program could help. During my travels as a commissioner, I've witnessed firsthand some of the tremendous benefits that telemedicine has provided to rural America, especially in areas of Alaska that are not even connected to the road system, let alone a healthcare system. Although the Rural Health Care Program has been successful in some parts of the country, more Americans could stand to benefit from it. As such, I commend the chairman for initiating this NPRM, which seeks comment on a variety of ideas to reform the program. Thankfully, allocations for the Rural Health Care Program have never reached the Commission-imposed $400 million annual cap. With fiscal restraint in mind, the reform ideas outlined in this NPRM identify ways to bring the program's benefits to a greater number of rural Americans. In reality, however, if these reforms are implemented, we could face increased demand on the overall Universal Service Fund. As such, I'm pleased that the Commission is highlighting our intention to retain the $400 million spending cap. Additionally, I would be remiss if I did not reiterate my strong desire that the Commission identify and finalize reforms that provide savings in other areas of the Universal Service Fund. It is critical that the Commission undertake this examination in a comprehensive manner so that any reforms that we may implement in the rural health care arena do not simply result in runaway growth of the overall Universal Service Fund. This is not the first time that the FCC has made reforms to the program. Most recently, the Commission established the Rural Health Care Pilot Program, which both Commissioner Copps and I supported with all of our colleagues back in 2006, I believe. While the pilot program has shown some success, it did experience some bumps along the way. As such, I support our effort to build on the lessons we have learned from that experience. For example, the pilot program required a 15% match to all eligible costs. We learned, however, that some participants had difficulty obtaining the funds for the match requirement. To avoid this type of situation in the future, we propose that receipt of infrastructure funds be conditioned upon certification of the availability of matching funds. Finally, I cannot underscore enough that we need to always remember Congress's original intent in establishing this program under Section 254 of the Act. Congress's mandate was for us to ensure that rural parts of our nation are connected to medical assistance. Some parts of rural America simply do not have any access to health care, period. No doctors, no nurses, no technicians. To be fiscally responsible, we need to be mindful in this proceeding and in future proceedings that this program's mission is critically important to rural America, and Congress did not intend for it to be expanded to fulfill other goals. In conclusion, I really commend the whole team here for all your hard work on this challenging but very, very important initiative. I look forward to reviewing the record as it evolves and working with all my colleagues and stakeholders in pursuit of fiscally prudent reforms that also ensure that rural America continues to benefit from this program. Thank you, Mr. Chairman.
Thank you. Commissioner Clyburn.
Thank you, Mr. Chairman. I just returned from a trip to the great land where I had an incredible opportunity to see firsthand how USF policies that promote rural health care are making a difference in the lives of Alaskans. Through telemedicine, those who live in remote areas can receive care that was either previously out of reach or would have otherwise required them to travel hundreds of miles, often by aircraft, which is unbelievably expensive and often requires multiple days of work and school to be missed. Not only can our broadband policies help in delivering much-needed health care to hard-to-serve areas, they can also save consumers both time and money. As the National Broadband Plan recognizes, and as discussed in this notice, our policies can do more to promote better health care throughout our nation and improve even more lives in rural America. This notice is a very good start, and I am pleased that it specifically requests input from tribal governments in insular areas. There are certain geographic areas in this great nation that may require us to consider a different approach to address the unique needs found in those areas. As my trip to Alaska illustrates, our nation is vast and diverse, and one size does not necessarily fit all. I look forward to engaging with interested parties on the issues raised in this notice so that we can implement rural health care mechanisms that will benefit the most Americans. Thank you, Mr. Chairman, and thank you.
Thank you, Commissioner Clyburn. Commissioner Baker.
Thank you, Mr. Chairman. Of the many programs that we manage, the Rural Health Care Support Mechanism is one where we can vividly see how it has a difference in the real impact on the lives of consumers, which in this case are patients. It has already been instrumental in bringing state-of-the-art health care to remote areas where that was previously impossible. Many of us have been privileged to see firsthand the way the Rural Health Care Program has helped bridge critical health care gaps posed by unique geographic and economic challenges. My sense of how meaningful these rural clinics are to their communities was shaped in large part by my visit to see the Bristol Bay Area Health Corporation in Alaska, a system that now serves 34 villages and relies on communications technologies to bring quality health services to the tribes of Bristol Bay. Telemedicine and the networks to support it will become even more important as all aspects of our lives, including healthcare, become increasingly dependent and integrated with the internet. This program, however, has been significantly underutilized since its inception. The projected funding level of $214 million for this year is well below the program's cap. I hope commenters in this proceeding will help us build on the work of the National Broadband Plan and draw on lessons learned from the pilot program. We need to update the rural health care program to ensure that all Americans have access to health care services and benefit from advances in medicine, even if they live in rural and remote areas of the nation. At the same time, I think it is prudent to move forward with reforms to this program under the existing $400 million cap. I think it makes sense to figure out how to use the money allocated for this program better and more efficiently with appropriate accountability measures to achieve better outcomes for communities and patients without simply throwing more money at the problem. I look forward on working with the chairman and my fellow commissioners in the months to come, and I offer my thanks to the Bureau for your work on the item.
Thank you, Commissioner Baker, and I just have a few comments, but first, thank you to this incredible team for working on this important item. We very much appreciate the work that you've put into this, and as each of the commissioners has said, we're at an important point in what really is a very important project for the Commission and the country, and so we thank you. What we do, what you do at the Commission every day is important. It's typically not a matter of life and death. This is. In the 21st century, high-quality healthcare depends more and more on broadband connectivity. But today, as we've heard, too many clinics and hospitals lack affordable access to broadband connectivity that's adequate to handle basic telehealth tasks like transmitting an X-ray, an MRI, or other electronic medical records, or consulting remotely with a doctor. In fact, nearly 30% of federally funded rural healthcare clinics don't have secure and reliable adequate broadband services. These are clinics at the farthest reaches of the United States and in the center, in small-town Appalachia, in the great Northwest Plains, in the vast deserts of the Southwest, in Alaska and Hawaii, in virtually every region of our country. In some areas, the numbers are even lower than the distressingly low 30% average. Only 8% of Indian health service centers even have access to the broadband they would need to deliver advanced health care to their patients. To achieve the goals of a 21st century healthcare system, including telemedicine and utilizing electronic medical records, delivering better health care more broadly, lowering the costs of our medical system, we need to ensure that hospitals and clinics have the technology, tools, and connectivity they need. Today, I'm happy that we're introducing a new and transformed rural healthcare connectivity program that would expand investment in broadband for medically underserved communities across the country. The program would give patients in rural areas access to state-of-the-art diagnostic tools now typically available only in the largest and most sophisticated medical centers. This program has the potential to do for rural healthcare providers and patients what the enormously successful E-rate program has done for schools and students. The Health Connect program builds on the foundation of the existing rural healthcare pilot program and the lessons learned from the recent pilots to extend infrastructure in a number of places throughout the country, including Iowa, California, Oregon, Montana, West Virginia. We've learned very important lessons in terms of what works. We've learned lessons in terms of what doesn't work, and we've learned some of the questions we need to ask and resolve in order to get this right as we transform it. This process also brings together many important voices in the healthcare ecosystem, including clinics and hospitals, doctors and patients, broadband service providers, medical and technology experts, entrepreneurs and investors looking to support and unleash innovation in this vital area. The program's investment in broadband connectivity would not only improve care, would also help significantly reduce healthcare costs, potentially saving billions of dollars. It would spur private investment in networks, as well as innovative health-related applications, and would create jobs that range from building infrastructure to developing and implementing health IT solutions. Without increasing the projected size of the overall Universal Service Fund, this program would invest up to $400 million annually. We would keep the cap in place to enable doctors, nurses, hospitals, and clinics to deliver world-class health care to patients no matter where they live. The program would have a real impact on communities across the country, up to an additional 12,000 hospitals, clinics, and other healthcare providers, a 20% increase in the facilities eligible as compared to the current program. It would help connect what often is a limited supply of medical specialists to a growing patient base that needs their expertise and make it easier for people to get the treatment they need, be it emergency care, chronic condition treatment and management, or wellness promotion. These technological breakthroughs have a real impact on patients, their families, and the broader healthcare system. For instance, with telemedicine, patients don't have to travel long distance to receive care, jeopardizing their jobs and the jobs of their family members. Without the obstacles of distance, they're also more likely to keep appointments and complete treatments. People shouldn't have to choose between their jobs and their health, particularly in rural America where the distances required to see a healthcare specialist, that is too often a painful choice that people have to make. Broadband-powered telehealth can turn what today is a painful choice into a false choice, and again, achieving better care and lowering overall medical costs. The results of telemedicine have been remarkable. Broadband enables remote screening and counseling for diabetics and heart patients, remote monitoring of babies in neonatal intensive care units, and much more. I recently learned about a teenager in rural North Dakota who was in a semi-conscious state after a serious car accident. The closest hospital and expertise to treat her was more than 100 miles away. But the local hospital was able to use broadband to access the expertise necessary to save her life. In Massachusetts, a woman suffering a stroke was treated via video link by a stroke specialist 70 miles away at Mass General. Without the specialist consult, the woman wouldn't have received a life-saving drug and made a full recovery. Just recently, I spoke with doctors in Hawaii and California who've used broadband-enabled telemedicine to reduce long-distance chemotherapy visits by 90% and to save the sight of newborns through remote diagnostics. So this program is a critical step in fulfilling the vision of the National Broadband Plan. It establishes a fiscally prudent program to invest in infrastructure for healthcare connectivity without increasing costs to consumers and while making an expanded range of broadband services more affordable. It would stimulate private investment and innovation in both broadband and health IT. By requiring that participants secure matching funds for both infrastructure and services, we're forging a public-private partnership to act in a smart and fiscally responsible way. And by expanding the market for health-related technologies and applications, we'll promote innovation and private investment. With the help of all participants in this process, we intend to design and implement this program with the best ideas to drive real results and greater efficiency. And we need those ideas and participation over the course of the process. The proposed reforms, as I've said, would not only improve health care, but also reduce the costs of care, yielding a substantial return on this investment. Implementing an electronic health record system could save our nation over $500 billion over 15 years, but a functioning EHR system requires broadband connectivity. Remote monitoring of chronic conditions saves tens of billions of dollars more per year if there's connectivity and doctors are enabled to identify health problems early, thereby avoiding hospital readmissions and shortening average hospital stays. Now, to help monitor our investment, today's notice suggests developing performance measures to ensure that the funds supporting broadband connectivity are used in a manner that produces measurable and quantifiable results. And in addition to today's action, I want to take just a minute to mention another important step we'll be taking later this month to help unleash investment and innovation in healthcare-related devices by increasing the predictability and speed of regulatory approvals of those devices. We're collaborating with the Food and Drug Administration to better understand the future of wireless health technology and to promote investment and innovation in this strongly promising area. I look forward to working with each of my colleagues to launch this important healthcare program for the 21st century. I thank all of my colleagues for participating in this. I look forward to working together to getting this done. And staff, again, I thank you for your work on this very important item. Thank you very much. Unless there's more discussion, let's proceed to a vote on this notice. All those in favor say aye.
Aye.
All those opposed, nay. The ayes have it, so ordered, and the request for editorial privileges is granted. Madam Secretary?
Mr. Chairman and Commissioners, the second item on your agenda will be presented by the Office of Engineering and Technology, the Wireless Telecommunications Bureau, and the International Bureau. It is entitled Fixed and Mobile Services in the Mobile Satellite Service Bands.
And who will be presenting today?
A couple of us.
Excellent.
Good morning, Mr. Chairman and Commissioners. The item that we will be presenting is a notice of proposed rulemaking and a notice of inquiry that would take a number of steps to remove regulatory barriers to terrestrial use and promote investment in the mobile satellite service bands. This action would advance the National Broadband Plan's objectives of providing more spectrum for mobile broadband use. The item was prepared jointly by the Wireless Telecommunications Bureau, the International Bureau, and the Office of Engineering and Technology. Joining me here at the table is Jerry Matisse, Chief of the Policy and Rules Division of OET, Nick Oros, an attorney engineer in the Spectrum Policy Branch of OET, John Leibowitz, who's the Deputy Chief of the Wireless Bureau, and Mindell De La Torre, Chief of the International Bureau. In addition to the people at the table, I'd like to acknowledge the contributions on this item made by Ron Rapazzi and Jameson Prime of OET, Ruth Milkman, Paul Murray, and Eric Salvera of Wireless Bureau, and Rod Porter, Gardner Forrester, Carl Kinzinger, and Howard Griboff of the International Bureau. The item will be presented by Nick Oros.
Good morning, Mr. Chairman, Commissioners. The National Broadband Plan observed that there is a need for additional spectrum for terrestrial mobile broadband and that 90 megahertz of spectrum in the mobile satellite service bands could be made available for such use. This item begins a process to expand the use of the mobile satellite service spectrum in the 2 gigahertz, big LEO, and L bands to accommodate mobile broadband networks while maintaining sufficient mobile satellite capability. This notice of proposed rulemaking and notice of inquiry take a number of actions to further this goal. The notice of proposed rulemaking proposes to add co-primary fixed and mobile allocations to the 2 gigahertz mobile satellite service band. 40 megahertz of spectrum is currently allocated solely for mobile satellite use, and ancillary terrestrial use is allowed under a mobile satellite authorization. Adding fixed and mobile allocations to the band will bring this allocation into harmony with international allocations and is a first step towards more flexible licensing of mobile broadband services in the 2 gigahertz band. The notice of proposed rulemaking also proposes to apply the Commission's secondary markets rules to terrestrial use of the mobile satellite spectrum in the 2 gigahertz, big LEO, and L bands. The secondary markets rules allow holders of licenses in the wireless radio services to lease some or all of their spectrum rights to another party. These rules promote efficient, innovative, and dynamic use of terrestrial spectrum and expand competition among terrestrial service providers. The mobile satellite service providers are eligible to operate terrestrial radio networks ancillary to their satellite services. By applying the secondary markets rules to these terrestrial rights, the Commission will promote greater investment in providing terrestrial mobile broadband in these satellite bands. The notice of inquiry explores how to increase the value, utilization, innovation, and investment in terrestrial services in the mobile satellite bands. For the 2 gigahertz band, the notice asks whether incentive auctions, if the FCC is granted the authority by Congress, would be an appropriate mechanism to transition the band to mobile broadband use. Alternatively, the notice seeks input on other approaches for attracting investment to launch mobile broadband services in the 2 gigahertz band. More broadly, the notice asks what steps can be taken to increase the terrestrial use of all 3 mobile satellite service bands, the 2 gigahertz, big LEO, and L bands. The notice inquires into how to assess the future needs for mobile satellite services so that the Commission can continue to assure that these needs are met while terrestrial use of the mobile satellite spectrum is increased. The staff recommends adoption of this item and requests editorial privileges. Thank you.
Thank you very much. Your presentations are getting as efficient as we would like spectrum to be. Commissioner Cops, please.
Thank you. We're back to our Commission's constant quandary, I guess, which is how to get expanded use out of non-expanding spectrum. Wouldn't it be nice if we could make more spectrum, but we can't, so we need to find ways to optimize our supply by expanding flexibility of use for licensees and improving efficiency through new and innovative technologies. And to that end, I have long supported efforts, as exemplified by the FCC's creation of the Spectrum Dashboard, which I think we'll talk about later, to examine what spectrum is being used and how it's being used and whether it can be put to better use to serve the public interest. Similarly, I support examinations like the one we launched today that explore ways to maximize the use of our spectrum resource, in this case, several mobile satellite service bands. This proceeding does more than emphasize the need to intensify the use of spectrum for wireless broadband opportunities. It also serves as a reminder of the critical role that the mobile satellite industry plays in our nation's communications infrastructure. I am a true believer in the importance of satellites, and that's a sentiment I have carried with me since before I came to the Commission. I can still recall very vividly the shock waves that went through this country in 1957 in November of that year when the Soviet Union launched Sputnik. And I remember feeling just a little bit better several months later standing on the rooftop of a hotel in Florida watching one of the first satellites go out of Cape Canaveral. Perhaps the excitement of those early days of satellites won't ever be recaptured, but we do need to appreciate the contribution that satellites make to our national security and our national well-being, bringing service to some of the hardest to reach areas, the sustainability and redundancy that they bring to national security. You can't really say enough about that. I've seen it firsthand when I traveled to the Gulf Coast in the immediate aftermath of Hurricane Katrina. It was MSS terminals that were the first up and running, providing essential connectivity. And earlier this year, we saw the same unparalleled responsiveness and reliability when the FCC deployed a team to Haiti in the wake of the tragic earthquake there. Those two events serve as powerful illustrations of the need to preserve our satellite capability, especially in those bands where systems are operating on a globally or regionally harmonized basis. Once the benefits of harmonization are lost, they are probably lost forever. Luckily, our hard-working FCC staff is also mindful of these important considerations, and I am confident that what we are discussing in today's proceeding will result in a healthy and a very productive dialogue. And we must remember that we are not looking at an either-or proposition. Instead, I believe that while we consider all the options, we should focus on the interplay between the mobile satellite service and terrestrial wireless broadband. The potential for rural America, which we just talked about in terms of health care and for public safety, are enormous. Within the past year, we have seen, for one of the bands highlighted in today's item, an announcement from TerreStar, a 2 gigahertz licensee, and AT&T of a plan to offer an integrated smartphone providing wireless connectivity with backup satellite coverage. We can only guess where technology can take us through synergizing the different yet complementary strengths of mobile satellite and wireless broadband. Lastly, I appreciate the willingness of my colleagues to raise questions regarding the need for any mechanisms, such as perhaps spectrum fees, to compensate the American people for the terrestrial use of the public spectrum resource. For international policy reasons, as well as the current U.S. legal framework, a satellite licensee does not bid for its spectrum license through an auction. However, charging fees for the ancillary terrestrial use in MSS bands might provide incentives to ensure that the spectrum resource is used more efficiently and utilized more intensively. I want to thank the staff and the Office of Engineering and Technology, the Wireless Telecommunications Bureau, and the International Bureau for their hard work in bringing us this notice of proposed rulemaking and notice of inquiry. I look forward to working with all of them and with the chairman and with my colleagues as we continue to find ways to maximize the public interest benefits of our limited spectrum resources. Thank you.
Thank you. Commissioner McDowell.
Thank you, Mr. Chairman. During my time at the Commission, I've consistently supported efforts to remove regulatory barriers, create flexibility for licensees and prospective licensees, and therefore promote additional investment in communication services. We can all agree that all Americans, no matter where they live or work, should have affordable access to robust and reliable broadband products and services. At the same time, constructive public policy should aim to bring more spectrum to market while also promoting spectral efficiency. Accordingly, I'm pleased to support today's effort to seek public comment on ideas to promote greater flexibility for mobile satellite service licensees. I also support our separate inquiry into proposals for making additional spectrum available for mobile broadband networks. I am particularly interested in learning more about application of the Commission's secondary market rules in the MSS context, as discussed in our NPRM. Consumers benefit most when spectrum licensees have multiple and equal opportunities to increase their spectral efficiency, no matter their technology. Due to the time necessary to develop a full record on the ideas raised in our notice of inquiry, I urge that we move forward as quickly as possible on the rulemaking aspect of this proceeding. Given the condition of America's economy, it is more important than ever to do all that we can to bolster investment and opportunities for innovation and job growth. America's wireless consumers and the companies that serve them should not be forced to bear the costly burden of unnecessary delay. So I want to thank the assembled teams that we have here, and I'll also applaud the cross-connects that have been going on throughout the agency. That's also been a model of efficiency, which hopefully we can translate into spectral efficiency as well. So thank you, Mr. Chairman.
Thank you. Commissioner Clyburn.
Thank you. As everyone in this room knows, on June 28th, President Obama released a memorandum entitled Unleashing the Wireless Broadband Revolution. That memorandum asserts that our nation's exponential increase in the demand for wireless services will likely outpace the supply of spectrum currently allocated. It concludes that to address this looming spectrum shortage, we should promote an environment where innovation thrives, and we should take steps to unlock the value of otherwise underutilized spectrum. I agree with the President, and that is why I enthusiastically support the Commission's decision to initiate this proceeding. As the item explains, if we make prudent changes to some of the Commission's policies with regard to mobile satellite services, we can create incentives for the wireless industry to provide innovative ways to make greater use of the spectrum that we had initially allocated for MSS services. By promoting this innovation, we will help wireless carriers meet the unyielding consumer demand for wireless spectrum. I am pleased that the item takes a careful approach. In its proposal to subject MSS licensees to the Commission's secondary market spectrum leasing policies, the item wisely recognizes that not all spectrum leasing policies may be suitable for all MSS licensees, particularly those MSS licensees that also deploy ancillary terrestrial component services. The item also acknowledges that making MSS spectrum available through spectrum lease arrangements could raise some competitive or competition concerns. Accordingly, the item properly solicits input on the competitive factors the Commission consider when evaluating a spectrum leasing arrangement between an MSS licensee and a wireless carrier. I am also pleased that the notice of inquiry underscores the importance of maintaining MSS to provide services for the needs of public safety and federal government agencies, for rural areas, and for those areas that have suffered severe damage during natural disasters. The Commission must ensure that these communications needs continue to be met. I thank the staffs of the International Bureau, Office of Engineering and Technology, the Wireless Telecommunications Bureau, for presenting us with this thoughtful item. Indeed, over the past few months, the Commission staff has done a commendable job in meeting the timelines for the key broadband action items for this year. I believe it is prudent that the Commission continue to consider the recommendations in the plan in a timely manner. This is especially important in the wireless arena due to the increasing demand for wireless services. In particular, the Commission should timely conclude its consultation with NTIA on the prospect of pairing the AWS-3 spectrum. Should that inquiry result in the conclusion that pairing is not a strong possibility, we should proceed in our adoption of final rules by year end so that we can auction that spectrum next year. Thank you.
Commissioner Clyburn, thank you very much. Commissioner Baker.
Thank you very much, Mr. Chairman. I am very pleased to support today's notice of proposed rulemaking and notice of inquiry, which seek to implement the National Broadband Plan's recommendation to accelerate terrestrial deployment in the 90 megahertz of the MSS bands. Today further paves the way for mobile broadband deployment in that spectrum, while also serving as an important step in securing broadband access for all Americans. We must make more efficient use of spectrum, and we must take a long-term view when crafting spectrum policy. Our action today accomplishes both. The NPRM's proposed changes to the table of frequency allocation will add flexibility within the bands and consistency internationally. Further, the NPRM proposes to apply the Commission's secondary market policies to MSS-ATC leasing arrangements. This step draws upon the existing regulatory framework set by the Commission with respect to wireless radio services and will provide clear rules and procedures for spectrum leases with third-party entities, a significant improvement to our current ad hoc approach. Additionally, today's notice of inquiry asks important questions about how to best promote the introduction of new mobile broadband services in the 2 gigahertz band and how to increase value, promote utilization, investment, and innovation in terrestrial mobile broadband. I'm pleased the NOI also inquires about the best approaches for creating opportunities for standing along terrestrial uses in the 2 gigahertz band. I want to thank the staffs of the Wireless Telecommunications Bureau, the International Bureau, and OET for their work on this item. I tried to work, since Commissioner Kopp's put Sputnik in his remarks, I tried to think about how I could put Buzz Aldrin in there, but I couldn't make that work. But I look forward to working with my Commission colleagues on other ways to efficiently promote mobile broadband deployment and innovation and investment.
Thank you, Commissioner Baker. And let me echo your comments and those of, I think, each of our colleagues. It's a terrific thing institutionally for the FCC to see the range of bureaus and offices represented on this table: OET, the Wireless Bureau, the International Bureau, all of you working together efficiently and productively on this important item. And of course, we all know that there are other members of our team at the FCC who've worked hard on this too: our Office of Strategic Planning, our Chief Economist, and others. But it's a very important, we talk about this a lot internally, as the world changes and the barriers between what the different bureaus do break down, it's essential to foster this kind of teamwork that we've seen here, and I welcome it, and I'm very pleased that the benefits of it are being revealed here today, especially in the context of such an important matter. Today, we launch a new spectrum flexibility initiative as part of our major effort to promote world-leading broadband infrastructure here in the United States and to unleash the opportunity of wireless broadband. Having world-leading wireless broadband networks in the 21st century will be essential to our global competitiveness. Achieving that goal of world leadership won't happen without action. In today's global economy, with the focus other countries are giving to the opportunities of broadband, to stand still is to fall behind. To achieve our goals, we must increase spectrum for wireless broadband, increase efficiency, and reduce needless regulatory obstacles to broadband deployment. The item that we vote on today is designed to accomplish those objectives. Moving forward on a key initiative of the National Broadband Plan, we begin the process today of removing regulatory barriers to use of spectrum for terrestrial mobile wireless service in the mobile satellite service, the MSS bands. Now, we need both ground-based and satellite-based mobile broadband, and we intend to modify our rules in a way that both expands terrestrial mobile broadband and ensures that America has a robust mobile satellite capability for rural areas and for when disaster strikes. Our action today flows from the National Broadband Plan and is consistent with the recent executive memorandum, both of which recognize the importance of spectrum for our economy and call for an additional 500 megahertz of spectrum for broadband. This proceeding will help make 90 megahertz of prime spectrum available for mobile broadband while promoting efficient use of that spectrum, including through the use of secondary markets. Our action today also builds on the recent approval of the transaction between Harbinger Capital Partners and Skyterra Communications, which facilitated a multi-billion-dollar commitment to invest in a new 4G wireless network. These are examples of our focus here on FCC actions that will unleash private sector investment and innovation. This proceeding will open the door to exciting new opportunities in mobile, new networks, new devices, new competition, new technologies. The mobile broadband revolution is indeed upon us, with smartphones, netbooks, and other connected devices generating unprecedented capacity demands on our terrestrial wireless networks, almost matching the unprecedented opportunity. We are seeing an exciting, innovation-driven reinvention of wireless communications. This is how we've had significant job creation in the U.S. in the past, innovation and reinvention of industries, with small companies becoming big and big companies becoming bigger, competing and creating jobs in a rapidly changing landscape. We have an important role to play in this, and today's item contributes to that goal. Today, we take an important action to make our spectrum rules more flexible and increase the amount of spectrum available for mobile broadband. As I said, this will catalyze investment and spark innovation, create jobs, help increase broadband speeds and capacity, and take an important step to make sure that America has the spectrum it needs to lead the world in mobile. With that, unless there's any more discussion, let's proceed to a vote. All those in favor say aye.
Aye.
All those opposed, nay. The ayes have it. So ordered, and the request for editorial privileges is granted. Again, thanks again to each of you. Madam Secretary, please announce the next item.
Mr. Chairman and Commissioners, we will now hear from the Wireless Bureau, providing the Commission with an update on the progress towards a spectrum inventory.
Jim, please. Thank you very much.
Good morning, Mr. Chairman, Commissioners. Wireless broadband is increasingly essential to our economic success and to addressing pressing national challenges such as education, healthcare, energy, and public safety. Spectrum is therefore an essential resource, and smart spectrum policies are crucial to assure that the U.S. leads the world in mobile. Meeting this challenge is essential for future economic growth and innovation. That is why we are very happy today to provide you with an overview of the latest version of our Spectrum Dashboard. The dashboard allows the public to view information on spectrum licenses and allocations through a single, easy-to-use web portal, and will provide a foundation for preparing a comprehensive spectrum inventory. The dashboard represents the work of many bureaus. In addition to many staff in the Office of Engineering and Technology and the Wireless Bureau, I would like to thank staff in the International Bureau, the Media Bureau, the Public Safety and Homeland Security Bureaus for helping make their licensing information available through the dashboard, and the Managing Director's Office for his contribution to the web portal. Representing the entire team at the table today are Ira Keltz, Deputy Chief of the Office of Engineering and Technology, Monica Desai, Deputy Chief of the Wireless Telecommunications Bureau, Roger Noel, Chief of the Mobility Division in the Wireless Bureau, James Brown, the Senior Analyst in the Mobility Division of the Wireless Bureau, and then finally, I'm pleased to introduce Mary Booker, who's Chief of the Wireless Bureau's Spectrum Management, Resources, and Technologies Division, who will present the overview.
Good morning, Mr. Chairman, Commissioners. I am pleased to provide a brief overview of the beta version of the Spectrum Dashboard, which is an important part of the nation's wireless strategy. An essential element of the goals Jim mentioned is promoting greater transparency in spectrum allocation and management. Easy public access to information on how spectrum is managed is crucial to the deployment of new wireless technologies and services. For this reason, the National Broadband Plan called for a spectrum dashboard, which is the foundation of a comprehensive spectrum inventory. This effort is an important part of our overall goal to unleash 500 megahertz of new spectrum, the importance of which was underscored by the President last month. The Spectrum Dashboard was launched March 16th
and provides, for the first time, detailed information on how spectrum bands are licensed and allocated and potential uses for those licenses, all in one publicly accessible portal. Since the launch of the dashboard, we held a public forum in May to collect input on future upgrades and deployed enhancements in June to improve usability. Just yesterday, we held a webinar to familiarize more people in Indian country with the Spectrum dashboard so we can receive input on how to make it more useful to tribal nations. To date, we have received over 125,000 visits to our web pages, which speaks to the utility of the tool. The dashboard is a one-stop shop for plain language information on frequencies in the 225 megahertz to 3.7 gigahertz range, the frequencies considered appropriate for mobile broadband service. The Spectrum dashboard enables users to conduct their own searches or download useful reports, such as the spectrum available for mobile broadband in a given area. The search function is multifaceted and enables users to search by spectrum bands using a map, by the name of the license holder, or by license categories. We are actively seeking public input on the functionality of the dashboard. So far, we are finding that searching by spectrum bands and the map search function are the most popular. The public can also provide feedback through our feedback and discussion link and an online questionnaire. The interactive tools of the dashboard, such as the searchable spectrum band pictured here, make it easier to access useful information. The authorized services in these bands are listed on the chart along with a description of how the band is used. We have also created interactive maps, seen here, that are available through the map search page to allow users to quickly select a state and easily identify counties in areas that they may be interested in. Consumers can use these tools to identify what carriers are licensed to provide service in their area. The Spectrum dashboard also enables access to other relevant information, such as FCC rules pertaining to authorized services, technical information on FCC and federal allocations, and licensing mechanisms. For certain spectrum bands, the Spectrum dashboard results feature enhanced information, mapping, and research capabilities. Maps are available for any licensed search results. The maps show the total amount of spectrum licensed at the county level based on the search criteria. This functionality can be used to generate a map of spectrum held by particular carriers or the total amount of spectrum licensed over a particular area. One of the greatest benefits of the Spectrum dashboard is enhanced access to data. The detailed data associated with any license search can be downloaded for further review and analysis in Excel or saved as a text file. The beta version of the Spectrum dashboard, released in March, significantly increased transparency into how spectrum is used in the United States and set the foundation for a more comprehensive spectrum inventory. The broadband plan recommended that we continue to improve and augment the dashboard functionality and the data that's included in the dashboard. Since the launch, we have collected public feedback and have already implemented enhancements to improve usability. We plan to launch the Spectrum dashboard version 2.0 later in the fourth quarter as a step toward a comprehensive inventory. Version 2.0 will include more friendly features such as access to information on leased spectrum and identification of licenses that cover federally recognized tribal lands. We also plan to improve our attribution and counting methodology for cellular spectrum. In addition, we will hold a public forum in the fourth quarter 2010 to collect public input on additional bands, licensing data, and features that should be added to the Spectrum dashboard beyond version 2.0 to take us closer to a complete inventory. The aim of this effort is to bring the transparency to spectrum management that will help foster an environment of wireless innovation and investment. Clear information will also help us address the looming spectrum crunch as wireless broadband becomes even more essential to our economic success and to meeting other national priorities. Thank you for the opportunity to provide you with this update.
Thank you very much. We won't have a vote on this, but are there any comments from the bench? Commissioner Cox?
Pretty cool stuff. I think we're getting our broadband vehicle here finally put together. We've got the dashboard now with all the gadgets and gizmos and navigation devices of the 21st century. We've got the steering wheel, which is the National Broadband Plan, and all we got to do now is put pedal to the metal on the accelerator, and we can maybe win the broadband Grand Prix yet.
Excellent. Commissioner McDowell?
Thank you, Mr. Chairman. This is terrific. I've seen a demo and went out live to look at it to some remote, obscure areas just to kind of test to make sure that some more far-flung areas like Dickens County, Texas, or the Arctic North Slope had all the appropriate data in there, and it did, and it was absolutely fascinating. It's a terrific resource. It'll be very, very useful for so many people to look at for a variety of reasons. I think it's absolutely terrific, and everyone should be committed for their hard work on this.
Thank you. Commissioner Clyburn?
It's very hard to follow my favorite professor here, but any vehicle, oftentimes, in this space, people take things for granted. When you turn that cell phone on, you expect certain things to happen, and very few people in this world know exactly what it takes, all of the inputs, all of the particulars. This particular vehicle I'm excited about because it has the potential to let every single interested person know exactly what it takes to be able to effectively and efficiently communicate in this space. I am excited about it. I'm excited that in the smallest of towns, in the largest of cities, you'll be able to get a clearer picture of what this universe looks like, and thank you for all of your help in ensuring that will happen.
Commissioner Clyburn, thank you. Commissioner Baker?
Way to go. It's great. This version's great. The next versions are going to be even better. I look forward to continuing to work with it, and I really look forward to seeing what it does to promote the secondary markets, and I'm just very enthused about your work and appreciate it.
Thank you. And just a few notes. I think it's hard to listen to this meeting without, and I don't want to have this be too much of an incessant reminder, but the importance of spectrum and mobile to our future, to our economic future, to job creation, to investment, and also to tackling challenges like education, healthcare, public safety. What you're working on with this, and what I'm so pleased we're moving forward on aggressively, is some of the very basic work that needs to be done in order for us to meet our goals of unleashing spectrum, recovering spectrum, putting in place secondary markets for more efficient use, and making sure that we really do win this Grand Prix, which is so important to the country. A couple of notes on this. One is, as you can tell from this discussion, these goals are and should be bipartisan. The importance of spectrum to our economy, the necessity of moving forward with urgency on this inventory are things that have been endorsed and supported on a broad basis. I don't think anyone disagrees with what, for example, the President said in the executive memorandum recently, quote, America's future competitiveness and global technology leadership depend in part upon the availability of additional spectrum. The world is going wireless, and we must not fall behind. We here at the FCC, as you all know, have an important responsibility to play in this. This particular project is very important in it. It's one of the reasons that the National Broadband Plan, which some people thought would just focus on wired broadband, took wireless broadband so seriously, and in fact, spurred by the National Broadband Plan, we've been moving aggressively month after month to make progress on these important initiatives. Issuing the tower siting order a few months ago to cut red tape and speed up deployment of towers, that part of the infrastructure which is so necessary for success in mobile. taking steps a few weeks ago and again today to remove regulatory barriers, expand flexible use of spectrum in the MSS band, proposing in the National Broadband Plan an innovative incentive auction tool that will bring market-based incentives to the spectrum chart and increase the chances that we can recover significant amounts of spectrum and do it in a fair, smart, and efficient way. Fourth, another more advanced promotion of what we're working on with the FDA, working together to unleash the opportunity of wireless health-related communications devices, which can make such an important difference both in the healthcare of so many people and also, if we get this right, unleashing a tremendous amount of investment dollars that are waiting on the sidelines to make sure that they understand the process for approval of wireless health-related communications devices. So these are just some of the important initiatives that we're working on. I want to acknowledge NTIA and my colleague Larry Strickling. Our agencies are working together very closely on this. It's important that we continue to do so, and we will. I'd like to thank the leaders in Congress who have been very supportive of the spectrum agenda. These include, and this won't be an exhaustive list, Chairman Rockefeller, Ranking Member Hutchison, Chairman Kerry, Ranking Member Ensign, Senator Snowe, Chairman Waxman, Ranking Member Barton on the House side, Chairman Boucher, Ranking Member Stearns, many other members of both the Senate and House oversight committees. And finally, I just want to say a word about this commission. This commission across the table here has an extraordinary set of backgrounds and experiences to tackle the challenges of the wireless revolution. And I won't review everyone's different background here, but we know what they are. And I think it creates a dynamic for an excellent, productive working relationship at the commission level and together with the staff to advance our mobile future in the United States. As I think several of us have said, we know from our each individual experiences that the rest of the world is not standing still when it comes to broadband in general, when it comes to wireless broadband in particular. And I'm looking forward to working with each of my colleagues here on the commission, with the staff, and with others outside the commission to help drive great success and seize the opportunities of mobile for the United States. With that, I think there's another item that I neglected. Am I correct? There's no vote on this, is there? Is there a vote on this? There's no vote on this. All right. Then, again, thank you. And we have one more item.
Mr. Chairman and Commissioners, the fourth and final item on your agenda will be presented by the Wireline Competition Bureau. It's entitled Electronic Tariff Filing System.
And we did indeed save the best for last.
Good morning, Mr. Chairman and Commissioners.
Thank you.
Today, the Wireline Competition Bureau is pleased to present a notice of proposed rulemaking to streamline the Commission's tariff filing processes. And seated with me are Jim Litchford, who's a public utility specialist in the Pricing Policy Division, and Pam Arlick, who's an assistant chief in the same division. Pam will present the item on behalf of the Bureau, and I'd also like to thank R.L. Smith, Vienna Jordan, Gene Gold, Steve Funkhauser, Larry Barnes, Al Lewis, and Marcus Mayer for their work on this item. Pam?
Good morning, Mr. Chairman and Commissioners. This notice of proposed rulemaking seeks comment on rules that would require the electronic filing of all tariffs and associated documents through the Electronic Tariff Filing System, or ETFS. This will benefit carriers, Commission staff, and the public by streamlining the processes by which tariffs are filed and by creating a more efficient, open, and transparent flow of information. Electronic filing of tariffs and associated documents already has been in place for incumbent local exchange carriers since 1998. This item now proposes to require electronic filing of tariffs for all carriers, including all local exchange carriers that file tariffs with the Commission, specifically non-dominant carriers. The NPRM proposes that all tariff filers must follow the Commission's rules for electronic tariff filing and file through ETFS their tariffs, tariff revisions, base documents, and associated documents including applications for special permission. In addition, the proposed NPRM seeks comment on rule changes that would bring consistency and clarity to sections in Part 61 of the rules. For instance, the NPRM suggests applying existing tariff composition and formatting rules to all carriers instead of just dominant carriers. Applying a consistent format to all tariffs will benefit the public and Commission by ensuring tariffs are easy to identify and review. Finally, the proposed NPRM seeks comment on the time frame for compliance with any new rules. The item proposes that all tariff filers must begin using ETFS for all tariffs and associated document filings 120 days after a final order is published in the Federal Register. This proposed NPRM is truly an important step in streamlining our processes, reducing the burden of paper filings on staff in the industry, and creating open access to the public for these filings. The Bureau respectfully requests that the Commission adopt this item and requests editorial privileges. Thank you.
Thank you very much. Commissioner Cox?
I am happy to cast a vote in favor of streamlining. I think it's a win-win-win streamlining. It's streamlining which will make our jobs here at the Commission easier and more efficient and more cost-effective. Will make the jobs of those who file with us more cost-effective and easier, and will be a win for the public, too, who will benefit once they have the kind of broadband that they need to have to get hold of the kind of information they need from both government and business. So it's a good item, and I'm happy to support it.
Thank you, Commissioner Cox. Commissioner McDowell.
Thank you, Mr. Chairman. What we're doing today is a good thing overall. As a general matter, I do endorse efforts to streamline Commission processes in efforts to make them more user-friendly and less costly, and I think we're taking a great step to achieve those goals today. You know, tariffs and I actually go back a long way. So I remember it vividly. It was Monday, October 1st, 1990. My first day as a young associate, newly minted first-year associate. I was handed by the partner a tariff dispute. I had no idea what a tariff was. I thought it was the king's tariffs over which we fought the Revolutionary War, and I later learned that they are quite exotic and complicated creatures. And in the future, someday, I hope that the Commission can look beyond reforming just the mechanics of how tariffs are filed and consider whether the day will ever come when we could discard the tariff system altogether. If history is to be our guide, we may indeed find that markets and innovation have moved beyond the regulatory structures of the past. But Sharon, you listed a cast of thousands, it sounded like, who've been working on this matter, worthy of a Cecil B. DeMille movie. So that, I think, underscores just how much work the current and old, antiquated tariff system has required of our very talented teammates here at the FCC. And now if we can actually enter the 21st century with these types of requirements, they might have time to work on something else that's more constructive. So I'm delighted to be able to support it, and thank you, Mr. Chairman.
Excellent. Commissioner Clyburn.
Just briefly, while rulemakings that address administrative processes are not always the types of items that folks clamor to work on, they are important for ensuring that this agency is providing efficient service and up-to-date information. So I thank the staff for their work on this item, which I expect will be a welcome improvement to many who frequently work with and rely on CLEC tariffs. I anticipate that many will benefit from an electronic tariff filing system that allows ease of online filing and use, including consumers, carriers, and the agency.
Thank you, Commissioner Clyburn. Commissioner Baker?
Amen, and I agree with the intelligent and profound words of my fellow commissioners. Great item, great work, incredibly complex, and this is really going to enhance efficiency and transparency. Kind of another one in the line of things that Chairman Genachowski has done to bring this agency up to speed with the way reality works, and a number of the innovations in the agency processes that are actually getting quite better. Going to facilitate communication for the public and America, so that's all good. So just terrific job, and thanks for your hard work.
Well, thank you very much. I appreciate that. I appreciate this item. Let me acknowledge the people who are really driving the collective goal we have of making making the FCC a model for excellence in government in the 21st century. Obviously, Sharon, you and Pamela and James and the people you mentioned, but also our managing director, Steve Van Rokel, the new media team, many people focusing on technology around the agency, incredible opportunities for us to embrace digital technology, apply them to our everyday processes, save money for us and for industry that interacts with us, provide more transparency, provide more efficient decision making. Some of you have heard me talk about some of my conversations internally with staffers who have to consult multiple databases and look at both electronic systems and paper systems when they just want to get some basic information. And our goal of moving everything to electronic filing, of taking advantage everywhere we can of efficient, transparent digital technology is one that I'm glad that we do all share and that we're moving forward on. This item is an example of our broader data innovation initiative that includes our electronic comment filing system, that actually includes the Spectrum dashboard that we heard about earlier, that includes a long list of initiatives already in place, many more to come, that will again save money, save trees, open up the agency, produce faster decision making, more focused on facts and data. I couldn't be more pleased by that, and I'm glad that it adds to the list of successful items that we're working on together. And as I said, trying to achieve our goal as quickly as possible of having the FCC be the model for excellence in government in the United States, in the world. With that, let's move to a vote, please. All those in favor say aye.
Aye.
All those opposed, nay. The ayes have it, and the request for editorial privileges is granted. Before we adjourn, I have a couple of announcements and acknowledgments. Thank you to the team. Again, we appreciate your work. I was delighted to learn earlier this week that I'm not the only person who thinks this is a great place to work. This past Monday, the Office of Personnel Management released the results of the biannual survey of federal employees. And according to the people whose opinions matter the most, our employees, the FCC is the most improved agency in the federal government. This is, of course, a team accomplishment, a staff accomplishment, made possible by the hard work of people in every single bureau and office of the agency. I'd like to take this opportunity to recognize and thank a number of people who made the achievement possible. Let me start with my fellow commissioners, beginning with Commissioner Copps. On his first day as acting chairman, Commissioner Copps told FCC staff that, quote, "We must be credible not only in what we do, but how we go about doing it." Commissioner Copps elevated agency operations to the top of the FCC's agenda with an emphasis on improved communication and openness, and we've tried to build on those strides over the past year. Commissioner Copps, along with Commissioner McDowell, have proposed specific improvements to FCC processes, which are all part of the reform agenda. I'm grateful for that. I think the input has helped make the agency a better place. There's, of course, a lot more work to do. I want to recognize Commissioners Baker and Clyburn, both for contributing excellent reform ideas and also for championing the concerns of all of our staff, including working to open new opportunities for women and minorities. Very special thanks to Mary Beth Richards and Steve Van Rokel and their teams for their ongoing efforts to make our agency more effective, more efficient, using a mix of old school know-how and new technology tools. There's an increased emphasis on career development at the FCC, on engaging with staff all through the agency, on making sure that we have the kind of cross-agency collaboration that we saw today, without which I don't think the agency can work. And most important, I want to thank every member of our staff. Change is never easy. Then add the fact that the OPM survey was taken at a time of almost unprecedented activity for the agency. The midst of one enormous project, the National Broadband Plan, right on the heels of another, the DTV transition, in addition to all of our regular ongoing work. It would have been understandable for everyone who got a copy of that survey to have felt overwhelmed and put upon and frustrated. And it's quite remarkable, I think, that the survey confirms what all of us have seen firsthand, an energized staff committed to the public interest, embracing these challenges, lifting the agency to new heights. Of course, we have a lot more to do to improve the agency. The best ideas, I think, will continue to come from the bottom up. Reboot. The internal FCC website continues to run. It continues to be a forum for ideas and suggestions. And the process of transforming the public reboot is well underway, and we're all looking forward to the results of that. Again, thank you all for working so hard to make the FCC a model for excellence in government. To build on the agency's momentum, we're fortunate to be adding some members to our team, particularly to my team. So first, I'm very happy to welcome Josh Gottheimer to the chairman's office. Josh is in the unenviable position of not only coming in when we've gotten a good report from OPM, but also filling the enormous shoes of Colin Kroll, who we had a chance to say goodbye to at our last meeting. Josh has an extremely impressive background. In addition to being a terrific lawyer and successful executive, he's a noted author and advisor. Tremendous energy, Josh, and a wonderful sense of humor. I'm very pleased that Josh was willing to leave the private sector and to return to public service, and that he chose the FCC to come back to. Welcome, Josh. And I'm also delighted to welcome Rick Kaplan to the chairman's office as chief counsel. Rick joined the agency last year. I am beyond indebted, Commissioner Clyburn, to you for training Rick so effectively, raising him up, not keeping him hidden, and for being so gracious and generous and allowing him to move over to the chairman's office. I appreciate it very much. Of course, it's obvious to all of us that Rick distinguished himself in his role with Commissioner Clyburn, and he brought to the FCC a remarkable set of accomplishments from being a sports agent, entrepreneur, to also having been a public servant working in Congress. In addition to helping manage the overall agenda of the agency, Rick will have particular responsibility for wireless, engineering and technology, and public safety issues. I look forward, Josh and Rick, to your work and insight in helping us achieving our core goals around 21st century communications. Everyone on the team is looking forward to working with you, and I thank everyone on the team for welcoming Josh and Rick so well. Eddie, in particular, thank you for driving all of these agendas and continuing to move us forward. Now, the downside to welcoming Rick, of course, is that it means that we're saying farewell to his predecessor, Bruce Gottlieb. Now, Bruce, this is as tough as any goodbye I've delivered, and not only because you generally write my remarks, and I have to do this one by myself. Bruce, as everyone knows, has provided the intellectual force behind so many of the agency's most important policies. He's been instrumental in building consensus between commissioners where disagreements seemed insurmountable. Bruce feels the pulse of the agency like no one else here, and consistently has offered insightful suggestions to improve it. He not only knows the history of the agency and of our policies, he has consistently kept us pointed toward a bright future of opportunity for our country. As Bruce's former boss, Commissioner Copps, has said, it's not just what Bruce does, but how he does it that makes him so special. Bruce is quick with a quip and a sly smirk. If you look over there, you might be able to get the camera. Driven by a remarkable will and guided by a strong moral compass. Bruce, you've been a great colleague. Only Colin is a great... Colin, you've been a great Bruce and a great colleague, and you'll remain a great friend. You have made a real difference for the better in the lives of the American people. And for that, we all thank you, and I would ask everyone to acknowledge the incredible work that Bruce has done here at the FCC. And with that, no obligations, but would any of my colleagues like to add any words?
Yeah, first of all, Mr. Chairman, thank you for your very kind words. Thank you for the leadership you have brought to this place for a little over a year now in opening the place up and letting people do what they always wanted to do, and that is their jobs and to utilize the God-given skills they have, and I think we have seen tremendous progress in that over the period of the past year. It's a job, as you know as well as I, that's never done, and we keep working on it, but I've always been attracted by your term model for excellence, and I think we are making this place into a model of excellence. It's always been kind of a model of excellence to me, given the great talent that we have here. But I think given the cutting-edge issues we have and the cutting-edge folks we have here, our best days are still ahead of us, and I look forward to working with all of you to make that happen. That being said, I have no idea why Bruce Gottlieb would want to leave here. But we congratulate him on his new assignment. As I said when it was announced, Bruce brought really glowing brilliance. He's a shining star around this place. I had the good fortune of recruiting him to come here and having him work here, and then he said he was going to go off and work for the transition for a while and come back, but for some reason he never quite made it back to my office. But it was was to the great benefit of the commission generally that he ended up as chief counsel and senior legal advisor, and just the incisive analysis he brought to every issue, the deep intelligence, the good analytical skills, and the ability to express himself so well, I think just kind of combined to make him a model public servant around here. I know he has many more contributions to make in the years ahead. I hope at some point he'll be coming back to public service again, but I think he's going to have some opportunities for public service in the position that he's going to too. But we'll miss him. We hope we'll have the benefit of his friendship and company going ahead, and our best to him and his lovely wife Katie and his charming daughter Annabelle. I also want to join you in welcoming Josh here and welcoming Rick Kaplan to his new role in your office. We've had the pleasure of working closely with Rick. He came here to help us on the digital television transition and did a masterful job in helping us weather that storm, and I think he's been superb as counselor in Commissioner Clyburn's office, and I know he will provide great leadership in his new job too, so we look forward to working with him.
Thank you very much.
Mr. Chairman, yes, thank you. First of all, I'm terrible at goodbyes, so I do want to start with Bruce. I asked my Chief of Staff, Angela Giancarlo, several times to try to write down some thoughts about Bruce, and each time I asked her, she burst into tears and was unable to produce anything. So then it fell on my shoulders, just as Bruce couldn't write his own remarks for you, Mr. Chairman. Then I burst into tears, actually, when I started thinking about it. So I'm going to have to wing it, and you'll see just how bad I am at goodbyes. But in all seriousness, Bruce, you've been a wonderful colleague, and you're always cheerful and always a gentleman. You've always been an island of calm at the commission when sometimes the emotional waters get a bit choppy. There's always a way to find agreement with you, even if we disagree fundamentally on some other aspects of whatever it is we're working on. Your intellect is second to none, and your integrity is as well. We're going to miss you. This is a sad day, literally for my office personally, but also for the commission. I know the opportunity you've got in front of you is absolutely amazing. and look forward to seeing your continued success there. But thank you for your service to your country and to the Commission, but just as a friend, wanted to say thank you as well. So, Rick, no pressure. We're not going to measure you by Bruce's standards. So, no, but it's been a delight. I think this is a fantastic choice by the chairman, and I want to echo what former acting chairman Commissioner Kopp said. That's a long title. About your work on DTV. That's when I got to know you the best. But not only is your intellect and your demeanor fantastic, but you cut a wide swath, as they say. I just remember hearing about your success at the craps table in Vegas, and I think hopefully you're bringing the same amount of luck to this job. And Josh, I look forward to meeting you. So I know that day is coming soon, so good luck. How's the first week been so far? Yeah, I bet. So, but Godspeed. Look forward to talking to you one-on-one. Thank you, Mr. Chairman.
Good, thank you. And actually, why don't I'll ask my other colleagues to speak. If there are any other staff announcements, feel free as we go. Commissioner McDowell, all set? Commissioner Clyburn.
Thank you, and I will start with those if you will allow me. Angie Cronenberg, who has been advising me on wireline, broadband, and universal service issues since December of last year, is assuming the responsibilities of Chief of Staff in my office. I'd like to thank her. And Eloise Gore, Associate Bureau Chief in the Media Bureau, is currently on detail advising me on media and consumer issues. I want to congratulate Rick Kaplan on his appointment to the chairman's office. Rick, as you all know, was instrumental in my Senate confirmation process and shaping my office during the first 11 months. His management of the office was always exceptional, and his quick wit and wonderful sense of humor kept us on our toes. While Rick will be sorely missed by my office, must be so sorely missed I can't say it, I'm thrilled that the Commission will continue to benefit from his great intellect and dedication to public service. We wish you all the best. And Bruce. Bruce was basically my first face to this Commission. Jessica Zufalo said, "You've got to meet Bruce. If you know Jessica, that same type of cadence, but I won't pick on her today. You got to meet my friend Bruce. I mean, I know you need help. I wish I could help you, but Bruce is the one." And I met Bruce and immediately fell in love. Tell your wife I said it. With Bruce, I mean, he's just was always there. And when time was too tight for him, he said, "I want somebody else I want you to meet, but here's my phone number, here's my personal email address. If you need anything, just call or reach out." And a couple of times when I was whining at midnight, by 12:30, he would email back and say everything was going to be all right. I'm going to miss you. But most of all, you talked about all of his other attributes. I'm going to miss the hair. I'm going to tell you plain, I'm going to miss the hair. It was like a barometer of what was going on here. Sometimes when it was spiky, I knew things were okay, and when it started growing out a little full, and I was like, whoa, things are really happening in that office. So I don't know what I'm going to use to figure out, that was my, I don't know what I'm going to use to figure out what's going on in the office, but I don't know. I'm going to miss the hair, but really, seriously, I'm going to miss you terribly. Your dedication to public service, it's been said. Everyone knows it. But I look forward to working with you. You said if I ever needed to whine and cry, you would be there and hand me a handkerchief. I'm going to take you up on that. Thanks. And I know that we like to tease Commissioner McDowell for somehow tying every single item before this commission to Duke basketball. But, Commissioner, considering it was my alma mater, first championship in a major sport, I would be remiss if I did not acknowledge the fact that the University of South Carolina won the College World Series since our last meeting. Go Gamecocks. Thank you.
Excellent, thank you. Tough act to follow.
That is the burden I bear, yes. I wanted to just say, Bruce, really, personally, but also on behalf of my team and really on behalf of the entire FCC and the greater community, we are so excited for you and your opportunity, but we are just really, brokenhearted. It's bittersweet for us. We are just so grateful for the contributions you've made. You're affable. You're so intelligent. Your commitment to teamwork is just got a new level. You know, when they say that people have a sterling reputation, I was thinking about this. You really have a platinum one. You have raised the bar to how to be a public servant and how to be a friend. And we are so grateful for that. You are the glue that holds this place together. So good luck, Rick. We're big shoes to fill. I'm sure you're up for it. I know you are. But, Bruce, good luck to you. I think Charles can fill the crazy hair role, okay? So I think that we're good there. The only person who really is happy about this, I think, as we thought about this in our office, was really Caroline Gillen, because she can now claim the cutest 2-year-old princess on the 8th floor. So with Annabelle's departure, I think she may be happy, but the rest of us are thrilled for you, sad for ourselves, but that's what life is about, the reemergence and the next challenge. So we wish you well. We love you. So thanks.
With that, Madam Secretary, will you announce the
next agenda meeting? The next agenda meeting of the Federal Communications Commission is Thursday, August 5th, 2010.
Thank you, Madam Secretary, as always, and we are adjourned. Here, as you saw today, as you've seen in past meetings, we're moving forward very energetically on what was an aggressive implementation schedule for the National Broadband Plan that we announced a few months ago. And so across the agency, staff is working around the clock to try to meet the targets that we set in the implementation plan. I'm sure you know how hard the Public Safety and Homeland Security Bureau and the Wireless Bureau are working, in particular on delivering a successful plan on public safety that meets the needs that were laid out in the plan. So people are working very, very hard on this. It's important, and nothing to announce right now on timing.
Are you surprised at the massive resistance by the major public safety groups to your plan for the public safety broadband network?
Well, we've seen, a tremendous amount of bipartisan support for the plan. You saw that the Fraternal Order of Police, the International Firefighters Federation have supported it. There continue to be ongoing discussions. There are others who also have supported the broadband plan, the 9/11 Commission, chair and vice chair on a bipartisan basis, and others. The thing to keep in mind is that the public safety plan in the National Broadband Plan is a multiple-part plan that many people have praised as the best plan they have seen to finally move the country forward on the recommendations of the 9/11 Commission to make sure that we have a mobile broadband public safety network for our first responders. You've seen action on the Hill in terms of the draft bill on the House side, statements from Congressman Waxman. So there's a lot of work to continue to do, but there's a tremendous amount of support on a bipartisan basis for the plan that was laid out in the National Broadband Plan.
Mr. Chairman, I understand that the rural health care rulemaking that you all approved today expands the kinds of facilities that are eligible for funding as well as the amount of support they can receive in some cases. But given that for many of these rural health care facilities, they already had access to this money before, but for whatever reason chose not to participate, what do you see changing now that this plan you rolled out today, or this rulemaking that you rolled out today, is going to change?
Well, there are a few pieces that I'll mention now, and there'll be other elements too. One is the proposal today expands the number of eligible facilities, and you saw that reported on in the meeting. So facilities that previously hadn't been eligible are eligible. Second, one of the things that we learned from the pilot projects is that there were artificial exclusions from eligibility that actually interfered with the goal of broadband access. So if your data center wasn't on site or didn't comply with the rules that existed, it just didn't work. And so one of the proposals today is say, let's look at how rural healthcare facilities actually organize themselves for broadband, and let's make sure our rules are consistent with that. There are also various challenges and obstacles in terms of how people applied, people knowing about the program. I think what you're seeing today is one, an effort to learn the lessons from both what's worked and hasn't worked of the pilot program and implement it. Two, make it a real priority of the agency so that we move quickly, educate recipients about the opportunity, make sure we have mechanisms that work. Some of these issues have been ironed out in E-rate and USF. It took some time in E-rate to make sure that schools who were eligible understood what to do to take advantage of the opportunity. We're, with this program, we're really in the second inning, or the first inning, really, as compared to where E-rate is. So those are some of the things that we're doing, but I think all of us have come to realize, and I've had very good discussions on this with each of my colleagues, that the opportunities of telehealth are just enormous in terms of improving healthcare for people who don't have access to it now, and lowering costs. We each go out and we meet with people and we talk to people and we see examples. The most recent one that I saw that was most compelling was one where a lot of people who have cancer and need chemotherapy live a long distance from facilities where they can actually where there's a doctor who can administer chemotherapy. And so if a typical chemotherapy regimen is 6 months and there are 2 visits a month, that means that someone who, by the way, has cancer, needs chemotherapy, has to travel, and now we're talking for people in rural areas 2 or 3 hours to get their chemotherapy treatment. It obviously doesn't make sense, but in a world without broadband, there's not much you can do about it. What broadband allows is instead of having an ill person with cancer who needs chemotherapy travel back and forth for many hours every 2 weeks, often having to make the choice between whether they do that and keep their job, they can stay where they are. And in one place in particular that I saw, the 12 visits over 6 months became 2, one at the beginning, one at the end. And with broadband and remote video connections, the chemotherapy can be administered locally, and the bi-weekly consultations with the expert oncologist can be done on a video basis with the local health professional there. And you just listen to stories like that, and there's so many, and you think, wow, well, obviously that's going to improve healthcare results. Obviously it's saving money, and obviously it's increasing the chances that this person can keep their job while they're going through a chemotherapy regimen. So I'm very enthusiastic about this. I think that enthusiasm is shared, and we're going to be doing a lot of work on this because it's very important for the country.
Mr. Chairman, what conditions, if any, would you need from the telecom industry in order for the FCC to abandon its plan to reclassify broadband as a public utility? And have your meetings this week led you to believe that industry might be on board with those conditions?
Well, the comments in that proceeding just came in today. We're relatively early in a comment cycle, and as we do in matters like this, there's very broad consultation with all stakeholders. I can't predict where it's going to come out. What we're focused on is making sure that we drive U.S. leadership in broadband, that we drive investment, innovation, competition, protect consumers, exactly what we've been talking about for the last year.
To go back to the rural health care program, do you expect that in the first year or two that you would go up to the cap? How soon would you expect demand to increase under the new rules?
I don't think we know yet. I think we've indicated a willingness to go to the cap, but and we think that ultimately the demand is going to be higher than the cap. I think that's a good thing because it will allow us to bring competitive dynamics into the program. To look at race to the top like elements where potential applicants have to meet criteria in terms of bringing in co-investors, in terms of making sure that they deliver on the promise of the program. So it's too early to tell when we'll get to the cap. We'll know more as we go through the process, and we'll be happy to report on it.
All right, thank you very much.
Thanks, everyone. Have a great day. Thanks, David.
Thank you, Mr. Chairman. We'll now proceed to the Bureau Chief portion of the post-agenda press conference. We'll start with the rural health care item. Do you have questions on rural health care? Okay. Sharon Gillette. Come on up. And her team. Who'd like to start? Ted?
Hi, Ted Gotch with Telecommunications Reports. I just wanted to clarify a couple of things because there were things mentioned they weren't in the release. I just want to make sure I heard clearly. Specifically, to the point that there is some the rulemaking calls for, I guess, raising to a splitting of the monthly reoccurring network costs with hospitals, clinics, and other healthcare providers, I believe. Is that amount now, did I hear correctly, 25%? So it's a doubling of that? Exactly. Okay. And can you, my question to the chairman, it was sort of addressed, but maybe not as specifically as maybe you all could offer. I had asked, this program obviously has been available to at least to rural health clinics for some time, and for whatever reason there hasn't been the interest, so that much of the money has gone unused, and was just wondering, he had mentioned that there were some, inefficiencies that there were some logistical things that now are being cleared up, and wondered if you could give any of the specifics that you think will lead to more usage, more clinics signing up for this thing.
There's several things in addition to the very real issue he mentioned, which is if there are limits in the program that keep you from using the program for the way your business is organized, or these are nonprofit businesses, but they're still businesses basically, and they're organized in certain ways, and if our rules don't match those ways, it makes it difficult. So let me give you a few examples of that. We have a current Internet Access Fund. It has a definition of Internet access that if you read it, what would come to your mind is, I'm dialing up AOL. It's a little dated. It needs updating. In particular, I think since that definition was put in place, HIPAA was passed, and various other privacy